But Shubhada will also have to unmute herself, and unki screen pe it is not showing her name.
I need to know when to begin.
Yeah, we'll let you know. We'll let you know.
Dr. Shubhada, आपको अपना नाम edit करना पड़ेगा. It's not showing your name.
Dr. Shubhada is coming under Anup Kumar.
आपको अपना नाम edit करना पड़ेगा.
This laptop is in my husband's
नहीं,
name.
आप अपना नाम edit कर दीजिए ना उसमें, नहीं तो people will have a confusion.
उसमें edit करूँ? How do I just change it? Is it?
Can you just send me the full name, please?
It is SHUBHA. How do you change the name here? Name here.
Tell me, Dr. SHA.
UBHADA.
SHAU.
SHUBHADA. Yeah, that's okay.
Let's start.
It's spelled wrong. It's spelled
yeah,
wrong.
we are live.
Shubhada Gupta.
SHUBHADA. DA Gupta.
नाम गलत आ रहा है आपका.
That's right, yeah.
Dr. Namrata, Dr. Garima, and Dr. Shubhada, thank you. We are good to begin. Good afternoon, everybody. Dr. Namrata, over to you. Thank you, everybody.
Hello, everyone. I'm so glad that we could all be here today. This occasion is very important because today we are celebrating womanhood, we're celebrating pregnancy, we're celebrating the most important thing in a woman's life. And this on the special moment of World Immunization Week 2021. And for the discussion today, we have two esteemed doctors who are going to be part of this panel. We all know how beautiful those days of pregnancy are and how we cherish every memory of those beautiful days. But did you know that there is vaccination that is actually available during pregnancy? And I was always of the thought that vaccination is only for babies or for kids. And I did not know that there is actually a vaccination that is available for pregnant women as well. And today, these two wonderful achievers are going to highlight this very important topic for us. So a very warm welcome to first Dr. Garima Jain, who is MBBS and DNB in obstetrics and gynecology. She's a senior consultant at Apollo Cradle Hospital, Brookfield, Bangalore, with a work experience of around 21 years. That's really amazing. And she specializes in preventive care and high-risk pregnancies. Dr. Garima, a very warm welcome to you. How are you doing today?
Thank you, Dr. Namrata. Thank you for the warm welcome and the good introduction. I'm fine, and I hope everybody here is also safe. Thank you.
The next doctor on our panel is Dr. Shubhada Gupta, who's MD, and she's the consultant obstetrician and gynecologist since 34 years. She seeks to deliver healthcare excellence at Amruta Maternity and Surgical Nursing Home and Amruta Fertility Clinic. And she is with us today and is going to impart her great knowledge on this topic. Welcome, Doctor. Glad to have you with us.
Thank you so much. Yeah. Yeah.
So we would love to start this or begin this discussion with you on the topic of vaccination. Firstly, would you like to tell us more about the World Immunization Week or its significance for us?
Yeah,
Dr.
sure.
Garima.
All right.
Right. Immunization is something which almost all of us are aware of it. And we know, like Dr. Nimrata said, immunization is something which we all thought was always for children. To try to bring an awareness about the immunization to help mass immunization, all countries were running their own immunization programs. To make it a uniform thing, WHO had taken the initiative to run something called a World Immunization Week, which was uniformly agreed to be the last week of April every year. And this is a part part of that initiative. This is basically to spread the awareness of immunization, and therefore we can bring about mass immunization so that we can move forward towards a safer society.
Wonderful. So we always knew that vaccination is given to kids. So why are we today talking about vaccination for pregnant women? And we were not aware of this all this while. So if Dr. Shubda or Dr. Garima can, let us know more about this pregnancy vaccinations.
Sure, sure. So I'll just say a few words. Yeah, as obviously Dr. Garima Jain said, all of us are definitely now aware about immunization in children. But at the same time, we all have seen that our patients have definitely understood the importance of injection tetanus toxoid during pregnancy. So, like, as they are aware about it and they insist that they take this injection during pregnancy, we need to inform them about more vaccinations which are available. So, it is not that they do not know. Right from villages to slum areas to educated women, everyone knows that they need 3 tikas, which was an older practice. But now we have different 3 tikas which we give to our patients. And with happening of COVID pandemic has certainly emphasized, and people have really, really understood that vaccination is the means for prevention. So now we all, as a doctor, are actually aspiring to kind of give whatever possible knowledge about their diet, about their exercise, about their vaccination, and see how we can prevent any illness. So now the medical science has to actually give the preventive aspect rather than just prescribe them and use the polypharmacy to such patients. And that is how this particular webinar is definitely of importance, and the week which we are celebrating for vaccination of women has its definite significance. So let us all strive for prevention rather than going for treatment of any particular illness. And pregnant women being one of the patient, like that is the window of opportunity when they visit their doctors. And we all as a doctor have decided that how we can give them good information, complete information, and use this opportunity for educating them.
Just to add a word here, like the theme for this year's of World Immunization, immunization gets us closer. I think with the COVID situation, nobody can understand that better. We are all waiting for the immunization so that we can all get back being closer.
So my now concern is that we were always told pregnancy mein don't take any risks and don't do anything. So are these really? I mean, there is no side effect of this vaccination, and there is no loophole to this, and it's not something that can affect the pregnancy in any way. That needs to be clarified to every lay person out there.
Certainly, yeah.
Yes, there is no doubt with it that immunization is something which is very safe. Any immunization that is run in the pregnancy has gone through lots of trials, and it is only after that when the safety factor has been approved that it is being used. Definitely, if somebody is going to say 101% safe, we have to always keep that little margin, but then risk versus benefit ratio, that means is this really harmful or is it going to give me a lot of benefit? So looking at that way, immunization in pregnancy definitely carries a lot more benefit than maybe the 0.001% harm may happen.
So if you have to sum it up, are these vaccines really important and what do they actually target?
I didn't get you. What exactly did you ask?
So my question is that are these vaccines really important and what do they target? As in how would they help a pregnant woman? The pregnancy vaccinations.
Right. So it is not just for the mother. Why we are targeting these pregnant women is we want to vaccinate them against whatever possible diseases and give them immunity so that they can pass this passive immunity to the unborn child. And when the baby is born, till initial vaccination and their immunization schedule starts and gives them protection. This mother's passive antibodies are the ones which are going to give them protection. So we are not just targeting the pregnant woman. We actually have additional a second person with them, that is their baby, who is going to get benefited by giving this vaccination. And now I think all of us have realized that how important, in fact, now we are also considering giving COVID vaccine to the pregnant woman. Of course, that's mainly for the mother, but the vaccines which we are going to, which we have started using since last maybe about 10 years or so, are targeting for even the early infancy, that is first 1.5 to 2 years, 2 months of the neonatal life.
Just to add here, the vaccines given to the pregnant mother do have multiple advantages. One, yes, like Dr. Shubhra said, protecting the mother from infections. Two, protecting the unborn baby and the newborn baby because some immunity has gone in. Three, when you are protecting the mother from the infections, you have probably prevented an iatrogenic or a stress-induced preterm delivery, and therefore you have prevented a baby from landing up in the ICU. And yes, when we have educated a mother about the importance of the vaccine, she definitely will take care of immunizing her child once the child is born. So we have too many advantages to be able to talk to our mothers about the immunization.
So now my question is, what is this 3 disease vaccination and what diseases does it target?
Dr. Shubhda, would you like to take it or shall I answer?
Okay, yeah. So the new vaccine of 3 diseases, it is targeting 3 important infections. Tetanus, which we all know, and if it happens, we really do not have any treatment. So prevention is the only treatment for curing tetanus, or rather, that's the only way out. Second vaccine is pertussis, which is against gram-negative bacteria, Bordetella pertussis. And the third one is diphtheria. So in India, they are known in their local languages by different names. And this particular trivalent vaccine, which we now advise, is also recommended for the children once their immunization schedule starts. So we protect them from 3 common pathogens, which can be really, really dangerous and can land mother as well as mainly the newborn in problem. So that is a trivalent or 3 disease vaccine. And the second one which we give additionally in pregnancy is the vaccine against swine flu or H1N1. And of course, Dr. Garima will elaborate more about that.
Right. So now coming to the swine flu part of the vaccine, yes, like we are all aware of it, swine flu is yet one of the droplet infections which can happen to anybody. Though, yes, for the last 1 year, we all have been relatively in a lockdown and wearing masks. So we thought the incidence of swine flu would come down. But the fact is that we are still having outbreaks of swine flu also. Now, if unfortunately a mother counters a swine flu infection at any time of the pregnancy, your body may not be able to cope up as well as somebody of your own age would get it when they are having the swine flu because of the changes in the pregnancy and because of the load from the pregnancy that happens on the lungs and everything. And many times the mothers need to land up in the ICU, and to save the life of the mother, at times we would be forced to do an early delivery. Therefore, swine flu vaccine is something which should be given to all the pregnant mothers. And it's disheartening to see that many of the countries have managed to swipe off the triple diseases what Dr. Shubda talked about, the diphtheria, pertussis, and tetanus. In fact, to the extent many of the African countries also don't have this disease. But we still contribute a large amount of this to the world data, and we are still having lots of our children dying because of this disease, whereas it is a completely preventable condition by taking the vaccines. So DPT, the vaccine that needs to be taken for the diphtheria, pertussis, and tetanus, definitely should be something which should be advocated, because not only saving the mother, we are also saving the baby, and we should be targeting towards becoming a country free of these diseases.
Wonderful. Can you provide some clarity on the schedule of these vaccinations in pregnancy?
Yes, yes. So we generally have a guidelines set up by our association. So we follow a Federation of Obstetricians and Gynecologists Association called as FOXY. And by their recommendation, we generally recommend injection of swine flu vaccine whenever there is an outbreak. So it can even be given in the first trimester, that is in the any time of the pregnancy rather. But on an average, if there is no such outbreak, then generally it's recommended to be given by around 26 weeks of gestation. While this triple vaccine is generally recommended between 27 to 36 weeks of gestation. And even American College of Gynecologists and Obstetricians have been following the similar schedule. In fact, different associations all over the world are following this concept of giving the vaccine between 27 to 36 weeks for when you consider this trivalent vaccine. Of course, we'll also elaborate the reason why we give it late. I think Dr. Garima can inform you about that. Yeah.
So when it comes to giving the triple vaccine, like Dr. Shubhada said, it is given anytime between 27 to 36 weeks of pregnancy. The reason why we are giving it a little later in the pregnancy, not at the beginning of the pregnancy, so that we have enough level of immunity building in, crossing over to the baby and staying in the baby for long enough, because the diseases that we are trying to protect with the triple vaccine are tetanus, diphtheria, and pertussis, for which we start the immunizations on the baby once they are about 6 weeks old, which completes by the time they're about 6 months old. So they take their own time to build up their immunity. So we want, when we have given you this vaccine, it should stay in the baby till the baby has built up its own immunity. That is why it is started little later than 27, 26 weeks and beyond, so that it stays in the baby for longer. An ideal time would be to try to finish it before 32 weeks, but though we can give it even as late as 36 weeks. And in case you have missed out the immunization, there is a role of even taking this immediately after your delivery also, to give some amount of protection. But the ideal time to take the triple vaccine or the 3 disease vaccine would be somewhere between 27 to 32 weeks ideally, but can be extended to 36 weeks of pregnancy. As far as the swine flu vaccine is concerned, the swine flu vaccine, like rightly said by Dr. Shubhada, should be given anytime whenever there is an outbreak. But in general, because India being a country where we do not have the seasonal changes, we are trying to recommend use of this vaccine whenever possible. Though from the safety point of view, the FOXY guidelines, the Indian guidelines do recommend after 28 weeks or 26 weeks of pregnancy. But internationally, it has been accepted that this can be given anytime after the first trimester, for the first 3 months, and can be also given in the first 3 months with equal safety if need be, if there is an outbreak. So the swine flu vaccine could be taken at any time of the pregnancy, though by our Indian guidelines, we are still giving it in the third trimester. And the 3-in-1 vaccine also would be given in the third trimester of the pregnancy, the last 3 months of your pregnancy.
I would like to know about the 3 diseases per se. So how would a child be vulnerable to probably an infection like pertussis or diphtheria? So how would the child be vulnerable to such infections?
Yeah. Right. So basically, pregnancy is always a social event. Now, unfortunately, because of COVID, we are restricting the number of visitors and not letting the baby and mother being exposed to so many people. But on an average, whichever state or no place you are in India, it is such a joyful occasion, and there are so many relatives who want to come and wish the baby that you cannot just stop the whatever contacts which come to the mother and this newborn. You cannot stop coming and meeting them with these newborns. Now, normally what we see is mother is the most common reason why baby can get infection. So she is the most common person who passes the infection to these babies. Now, other relatives and acquaintances who visit. So like anybody can transmit this because these are the infections, especially the pertussis and diphtheria. They spread by droplet, as Dr. Garima said. And if somebody is already infected, babies can immediately get the infection. So the concept of isolation of baby and people not visiting and not kissing the newborn is still not followed in our country. Everybody who comes and meets the baby wants to hug the baby, take the baby in the lap. So that is one reason why we all have to insist that we give the vaccination. Now in Marathi we call Ghatasar, or rather the no, this diphtheria is called as ghatasar, and whooping cough is also called as dangya khokla. Khokla is whooping cough. So these are not typically seen in the newborns, but if they contract this kind of infection, they can land up with NICU, that is the ICU requirement. There is a high percent, almost as high as 75% of the newborns who contract this disease require NICU, which is a big burden. So by giving this vaccine, we are definitely protecting the child, but at the same time, the social distancing to the newborn has to be maintained, irrespective of whether you have vaccinated the mother or not. But we do see incidences like those admissions in NICU. If one has to really go through what is the reason why they have got admitted, 75% are because of infections. So it is such a high burden on the healthcare system and obviously with the parents. So it's such an important vaccine that if we give this, the babies are definitely going to fare better.
Wonderful. So, to sum up all that we need to know about the World Immunization Week, and that the fact that vaccines are helping bring us closer, something that Dr. Garima, you would like to share on this topic?
Right. Yes, this year's theme for the World Immunization Week is vaccination or immunization gets us closer, and they could not have a better theme probably for this year with the COVID outbreak. There's no doubt with that. Since the COVID outbreak has happened, we are all connecting with each other only through the digital media and not personally. Definitely, okay, we are close, but not close like we would like to be. And I'm sure I think everybody sitting here is just waiting for when their turn would come in for the immunization so that they can start
Yes.
getting closer. So I don't think we need to really think more about it. But then while the vaccine for the COVID is still in the pipeline now for the pregnancy and the mother and the babies, let's at least not forget the other vaccines. Unfortunately, in the last year, with everybody being in the lockdown, with being scared to go to the hospitals, there has been a fallback in the immunization of all the babies and the mothers because of the number of visits to hospitals have reduced. And we would always fear that if we, and as when we come through this COVID outbreak, we should not have a resurgence of the diseases which we had started getting under control earlier. So we should not forget our routine immunization for all these conditions, whenever it be, whenever pregnant women are visiting the hospital, which they would definitely be visiting during their pregnancy, if not all the routine antenatal checkups like we were doing earlier. But still, we are calling people in for the 3 or 4 visits. So at least in those 3 or 4 visits, the opportunity should be used to immunize so that we can prevent the resurgence of these diseases. We don't want other diseases now coming up. We have enough of it with the burden. So immunization is definitely going to get us closer. Like you remember the ads of Do Boon Zindagi Ki, the polio drops, which has helped us to eradicate polio. Let's take it as an initiative and start getting these diseases also eradicated from our country.
Wonderful. That's a wonderful thought. Dr. Shubda, would you like to sum up the conversation on this topic as well?
Just to make it little more, historical maybe. So immunization is definitely not new. The first vaccine was used against smallpox as early as 1796. So it is more than 25 years that vaccines have been known to the human race. And because of such scientists, our human race has been able to conquer so many illnesses. Now, when you see the child's immunization schedule, there are at least 20 different vaccines against which we are giving the immunization. And now, because of COVID, there has definitely been understanding, and the adult vaccination is also being recommended. So it is not just that we immunize the children, we also are giving importance to the pregnant mothers and even the adult vaccinations against pneumococcal and meningococcal infections. So we all should know how we can prevent rather than land up with the trouble. So as Dr. Garima said, being a Rotarian, we were part of this polio vaccination. As the smallpox, in fact, stands the only disease to have been completely eradicated from Earth. Of course, scientists have preserved few strains so that if required, one can make enough vaccines, but that is the only vaccine which is definitely eradicated. Now polio, with so much of efforts and so much money which has been given by Bill Gates Foundation and different nations and our Rotary acting against it, it is almost now, you can say, like last year there was not a single case reported in India. And that is what we all have to strive for. Vaccine is the most important part of preventing infectious diseases. And I also urge all our listeners to see that how early they can themselves get immunized against COVID, and see that whoever is around them should also be adequately informed. There should never be an unnecessary fear, and all of us should get immunized against whatever possible diseases are. Now, we have been using this trivalent and swine flu vaccine for the last 10 years, and it has been definitely safe. Like, I don't have a large patient base, but we have been using for each and every person, and we've really never come across any major side effects. So we generally start advising our patients right from the first trimester that, okay, these are the tests which you have to do. These are the minimum times when you need to visit. And we generally call them at 12 weeks, then at 20 weeks, at 26 weeks, and 32 weeks, and see that the vaccination schedule is complete. So prevention is the key for survival of human race. And we all have realized that now in this COVID pandemic. So please, I urge all the listeners, do discuss with your doctors, with your gynecologists, and take the scheduled vaccine as per their advice. Yeah.
Wonderful. Thank you so much, Doctor. We will also start taking up questions from the audience now. So if anybody needs to ask any question, please leave it in your chat box and the questions will be sent to me, which I can address to the doctors. So anyone among the listeners who would like to raise any doubt or ask any queries, please feel free to do so now. In the meanwhile, I have a few questions that I have with me that we can take till the final questions come in. There is one question that I need to ask you is, what can you do if a pregnant lady has already taken the tetanus vaccine alone? And what about the other two diseases? So does she have to take the trivalent vaccine again? Or are there individual vaccines for the other two illnesses or diseases as well? Dr. Garima, can we take this one with you?
Yeah, there are no individual vaccines per se for the other two diseases of the diphtheria and pertussis in the pregnancy. So we are giving it as a trivalent vaccine, which has both the tetanus, diphtheria, and the pertussis. Now, because the Indian immunization schedule has the 2 tetanus shots, which are compulsory, many often we find that by the time our patients have reached by 28, 32 weeks of the pregnancy, the 2 tetanus shots are already done. And then the reluctance comes in, can I might take the Tdap, that is which has the tetanus, the diphtheria and the pertussis. Yes, it is 100% safe to go ahead and take the third dose, which has the third dose of the tetanus. It would not cause any impact as such. It would not have any harm. However, if it is possible, we can always give it as one dose of tetanus, and your booster dose of tetanus could be with the trivalent vaccine rather than giving 2+1. But sticking to the Indian immunization schedules, and because many of the women would start seeing us, but then to travel off somewhere else, we wouldn't want to miss at least the tetanus shots in the early part of the pregnancy. So going by that, we would like to finish our tetanus shots. And if we can counsel our patients, and they can take the first tetanus shot early and then the second one as the trivalent vaccine. We do not have separately for the diphtheria and pertussis in the pregnancy.
Wonderful. Thank you, Dr. Garima. Dr. Shubda, can you please repeat the dosage again? A couple of moms couldn't get it right. So can you just repeat the dosage of the pregnancy vaccination again?
Okay. Sure. So normally what happens is, in certain places, especially if patients are visiting government or BMC hospital, there they see that each and every mother is immunized in their first visit itself. So what generally we see is they're given the first shot of TT on their very first visit, and then they are told that, okay, you take the next vaccine after 1 month or so. But in private, where patients come to us, what we generally advise as per our association's recommendations is generally by the end of 5th month, we give them the first dose of tetanus. Now, I also say that this tetanus is not just tetanus, it is available as TDVAC. So it has a tetanus and diphtheria, which is generally given by around 18 to 20 weeks of gestation. Then we generally recommend the vaccine against swine flu by 26 to 28 weeks. And by 32 weeks, generally we schedule the injection of this tri-disease vaccine. So that is how we go about, and that's how we call our patients also. So what happens is, when they are about 18 to 20 weeks, there's one important follow-up which is necessary with sonography to rule out any structural or congenital anomalies. So we use that opportunity to give the first shot of tetanus and diphtheria, that is Tdap, and then we use the swine flu in the middle. But now with COVID, occasionally when patients are doing really well, and if there is a problem of them traveling, we also have started giving this swine flu vaccine and the trivalent vaccine at 32 weeks of gestation when they come for their next visit. So if we combine both these vaccines on the same visit, it is still allowed. In case you want to space them, then the gap has to be at least 4 weeks in between. But because of limitations of the visits, we now very often do this, that if patients don't come after the structural scan, we straight away give them this trivalent and swine flu vaccine whenever they come between 28 or 32 weeks, or between 28 to 38 weeks.
To just brief it up once more,
Yeah.
basically it is that there are compulsory vaccines of the pregnancy, which are the 2 shots of the tetanus injection, which by the government of India and by the FOXI guidelines, every pregnant woman in our country should be taking her 2 shots of tetanus injections with a minimum 4 to 5 weeks of gap between the 2 shots, trying to cover finishing her immunization before 36 weeks of pregnancy. So that is how it is scheduled. These are the compulsory vaccines. What we are talking about today, the trivalent or the triple vaccine and the influenza vaccine, these are kept as the optional vaccines, more so because of the cost factor. They have been proven to be very helpful. They have been proven to be very safe in the pregnancy and for the baby. It is only because of the cost factor, as on now, we are not able to include them as a compulsory vaccine schedules in our country. Therefore, these are kept as the optional vaccines, which definitely, as patients, you can discuss it with your doctors, and your doctors would also take the opportunity to discuss and explain these vaccines for you. The triple vaccine or the trivalent vaccine, the one for the Tdap, is taken ideally between 28 to 32 weeks of the pregnancy. The swine flu vaccine can be taken anytime after you have crossed your first trimester, but by the Indian guidelines, it is still given anytime after 26 weeks of the pregnancy.
Okay, so someone has asked if they've already entered the 9th month and are about to deliver the child, would the vaccination still be as effective and should it be taken during that time?
Yes, yes, yes. It is, as we discussed, it is definitely effective. In fact, the maternal antibodies, the transfer of these passive immunity is real, in fact, at its peak after 32 weeks of gestation. And it definitely gives the newborn more protection till the vaccination of newborn starts. So whenever there is an opportunity and if these vaccines are available, one should still take it even when they complete their 36 weeks of gestation.
Okay. Dr. Garima, so what are the benefits? Can we sum up the benefits of the 3 disease vaccination during pregnancy? Someone has asked this question.
Right. So basically, the 3 disease vaccine is covering 3 deadly diseases for the newborn baby, which is the tetanus, diphtheria, and the pertussis, which can land up with the babies having respiratory difficulty when it comes to diphtheria and pertussis and pneumonias. And a major reason why our babies land up in the ICUs in the first 1 year of life, or why our infant mortality rate, that is in the first 1 year of life, we lose a lot of babies. So when we are giving this vaccine, the 3 disease vaccine in the pregnancy, we are allowing the immunity to cross and go to the baby, which stays in the baby when we have given it a little later in the pregnancy. That's why when we are giving it at 28 weeks and beyond, it stays, the immunity levels are there in the baby till the baby has completed its 1 year of life. That is the time span where we still find enough level of immunity is there by when the baby's routine vaccines have been given. So your baby is completely protected from getting these diseases. You having taken these vaccines is not going to change the schedule for your baby's vaccine. The baby continues to take its vaccines by the normal schedules. And also because it has been proven that more often than not, like Dr. Shubda mentioned, that the reason why our babies get infected is because we have visitors coming in, we have the caretakers coming in, and it has been proven that almost 80% of the times the infection that a baby gets is from the immediate family or the immediate caretakers. So if I have protected the mother by giving the vaccine, one, it has crossed over and reached to the baby to protect the baby. Two, there is some level of protection that has built up in the mother also for the first 1 year of life, by when so my baby has started developing its immunities and can be safe. So that is the advantage of taking the triple vaccine or the 3 disease vaccine in the pregnancy. So it is more beneficial for the baby, but has also helped the mother to counter herself from getting some infections.
Thank you so much. So, Dr. Shubhda, do we face any problems like fever or redness or headache or any such minor symptoms after the vaccine that the woman should be aware of?
Yeah. So normally, like nothing comes, you can say, without any, when there is a effect, there can always be some mild side effect. So, but what we have seen is, okay, my video has stopped.
Right. So the major
Okay.
side, yeah.
Yeah. So, as you rightly asked, these are the common symptoms sometimes patients complain with. There's generally a local reaction because of the content of the vaccine, but they are limited as just mild pain or little pruritus or some pain in their arm. But then that generally gets, I mean, you don't really have to do anything, not even giving any medication, if you have counseled your patients adequately. And as I said, in my last 34 years now, of course, I have been using these vaccines for maybe last 10 years, and we've really not come across any major side effect because we do counsel them and they generally are very, very comfortable. But as you rightly said, there can be mild headache, there can be mild pain, a little itching or rash. But as I said, it is generally self-limiting and one need not really worry about it. Normally, we ask the patients to wait for about 15 minutes to half an hour following the vaccination. Meanwhile, we give them, basic information about their next visit, their diet and exercises. So half an hour just goes without any problem. And they are generally comfortable by then before they leave our clinic.
Wonderful. Dr. Garima, what happens if a child catches pertussis?
Oh, yes. If a child gets pertussis, it lands up with your child having presenting symptoms would be the child would have fever, the child would have cough or throat infection. That's how it starts off. And then the child goes on coughing.
Dr. I think we've lost Dr. Garima.
Yeah.
Can you continue the question by the time she joins?
Yeah. So correct. Hashika? No, okay.
No.
So as Dr. Garima was saying, we do generally, like though we call it as whooping cough, it's very difficult often to see patients, the newborns with cough. Generally, they have kind of secretions, they may run fever. There's something what we call as stridor, that is like they have difficulty in breathing. And these are the common symptoms, and once the diagnosis is made, they're treated accordingly. So more common that they have either fever, respiratory infections, and typical cough may not always be seen. Are we audible?
Yeah, you are completely audible.
All right.
Okay,
And then
now we have heard so much about influenza, flu. I mean, flu is something that's so common. So is influenza really a serious disease?
Yeah. It is. In fact, in spite of having had so much of COVID pandemic, in fact, influenza is still #1 cause of pneumonia, even in the adults. Not just in the young or newborns, even in adults. In especially Western countries, that is one of the, you can say, in fact, the #1 cause why patients get admitted in the ICUs, and #1 cause of pneumonias in Western world is influenza. We have now gone in the history and seen how Spanish flu kind of caused so much of devastation. So even here in India, we do see, though there is no seasonal variation, we do see influenza affecting our mothers as well, and even in the newborns. So common cold and cough landing them in pneumonia is not very uncommon, and that is why, in fact, as a part of FOXY, that is our association, in fact, what I feel is the patients who are from lower socioeconomic strata also need to be given these vaccinations, so we can actually lessen the burden on our NICUs and reduce our neonatal mortality. It is still not very low in our country. Other countries like Bangladesh and Sri Lanka are doing much better. We still are struggling with very high neonatal mortality here. So it is recommended for each and every pregnant woman, and let's see how we can help them.
So is the influenza vaccine only given in India, or even now it's been given in other countries, and which countries?
Yeah. So I think it's available in more than 40 countries. It has been, or maybe even more. It has been used very routinely in USA, Canada, European countries, New Zealand, Australia, and all their data shows how effective it is preventing the newborn infections. So it has been used elsewhere very routinely.
So what could happen if the child caught probably pertussis or maybe influenza? What next? How should a mother deal with that?
Yeah, so as we were discussing, in fact, why we give this vaccine is because these are the babies who will have further, NICU and hospitalization required. In fact, as I said, if you see the general kind of data, the NICU admissions when they are with infection, 75% are with pneumonia. So if we can control these by giving a simple vaccine shot, that is what our aim is. And that is why all the pregnant women should be aware See, basically, unless we inform them, they are not going to know about it. And that is what is this immunization week scheduled for. So let us see that how we can minimize the newborns suffering in their initial 6 to 8 weeks of their life.
Wonderful. So we've only discussed how important vaccinations are, but is there any vaccination that should not be taken, or any kind of vaccination which is contraindicated in pregnancy?
So normally, see, the vaccines which are commonly available, the basic concept of vaccine is to give a very low dose of that particular virus or bacteria, which will not cause any illness to the recipient, but will produce antibodies in that patient. So considering that somebody is pregnant, we will not really give all the vaccines, but vaccines which are killed vaccines can very, very safely given. And one needs to weigh what is more important. Is vaccination going to save the mother, or whether side effects are going to be worse? So suppose, like now all of us know that rabies is another disease, which if somebody gets, you cannot just revive that person. So rabies vaccine can be given whenever there is such a doubt of there is a dog bite or such thing happen. So that is one vaccine which is always given. Vaccines against hepatitis A and B can also be considered if a person is likely to get exposed. And now, like with this COVID pandemic, if somebody like health worker who's pregnant and is exposed, she's working all throughout her pregnancy, the recommendation has now come that you even vaccinate these frontline workers even if they are pregnant, because that is going to prevent the worsening of their condition than not giving them. So many vaccines which are available have been tested and they have been found to be safe. So you need to weigh every condition, and depending on what is the exposure against that particular disease, we need to vaccinate these women. Only one thing is, like very often when patient comes for pre-pregnancy counseling, generally we confirm. Normally what we have seen is if they are born in the metro cities, they generally receive complete schedule of their childhood immunization. But of late, a lot of governments had taken this initiative of giving vaccine against MMR, that is measles, mumps, and rubella.
And rubella, yes.
Yeah. So rubella is one disease which may not always cause symptoms, but if pregnant woman contracts it, it has very serious implications on fetus. Yeah. So normally we suggest the mother to take the rubella vaccine at least a month prior to before she considers pregnancy. That is one vaccine which we do not give during pregnancy.
Has Dr. Garima joined back in? Is she there?
Yeah, I'm back. Yeah.
Hello, how are you? Sorry, we thought
Okay.
you're not here.
Oh,
So
okay.
we would love to throw the next question at you. So Dr. Meenal, there's Meenal Sonal who wants to know how much time does vaccination, how effective, how long is the effect of the vaccination?
Right. When it comes to the swine flu vaccine, once you take the swine flu vaccine, it would take about a month before your body may develop a full immunity towards this disease. And the effectivity, because like you are all hearing about the COVID virus changing its strains and becoming mutant, unfortunately, the swine flu virus also is a virus which is known to be notorious for changing itself kind of every 3 to 6 months. So what we say is once you have taken a swine flu vaccine, it is protective only for that season. It is not going to be a lifelong protection. So it is protective only for that season. So it takes a month before you could build up a complete immunity, and it would be effective in you till that season lasts. And by the next season, there will be a new dose of vaccines, a new strain of vaccine, which is launched by WHO. And then if you want to be protected, you could continue to take the vaccine even later. It's not just in the pregnancy. As far as the triple vaccine or the 3-in-1 vaccine is concerned, this is more for the protection of the baby, and it is, again, it would take some time to build up the immunity in the mother to cross over and go to the baby, and that's the concept why we are finishing it before 36 weeks. Now, when you have taken this vaccine, because this is mainly for your baby, in every pregnancy you will need to repeat it. So suppose you get pregnant within 6 months or next 1 year for the next pregnancy, you couldn't say that I took it last time so I don't need to take it now, because we need enough levels in your body to cross and reach to the baby. So in the next pregnancy, again, you will have to re-immunize yourself.
So, if suppose you get some side effects from the vaccination, mild side effects like probably fever or maybe vomiting or something, then what steps should a pregnant woman take depending upon what trimester she's in?
See, like Dr. Shubda said, most often these side effects are so self-limiting that you might just have a low-grade fever or a little body ache or a little pain at the injection site, maybe for a day or two. Or normal paracetamol, if it is really bothersome, can be taken. As far as vomiting is concerned, again, we just find it may be an episode immediately after the vaccine and nothing more than that. So not really anything to be worried about.
Okay, thank you so much. Dr. Shubda, do we have to take this vaccine every time we get pregnant, or like if it's your second or third child, or you just take it for the first time and it's enough? The 3 disease vaccination.
Yeah. So Dr. Garima just mentioned it has to be taken in every pregnancy, and between this 27 to 32 weeks to have
So not
adequate,
only the swine
not just
flu,
yeah,
not the swine, even the 3 disease
even
vaccination.
yes. So swine flu is only for the season, while this is mainly for the newborns, and it has to be taken in each and every pregnancy, even if one has taken even a year before.
Okay. So, anything else that you think we need to know about the vaccination? Something that that we have missed in this conversation?
Well, we basically would like to say vaccines are safe. Vaccines are for everyone. It is not just for the newborns. It's not just for the babies. Before planning your pregnancies, if you see your doctor would get you to take a few more vaccines so that your pregnancy is a safe pregnancy, like the MMR vaccine and even the chickenpox vaccine is something which we may recommend. Also, post-pregnancy, there are a lot of vaccines which women can take to protect themselves, like the cervical cancer
Please
vaccine.
tell us about these. I was going to come to that question. So post pregnancy also, after that we forget we are there. We just care about the baby.
Yeah,
So
that's true.
something that we need to do, that would be lovely. Please, if you can share that as well.
Yeah, so basically, as Dr. Garima was saying, we have to use this as an opportunity and give whatever possible information for women to have a smooth further life. So one such vaccine, which is now going to get slowly, probably included even in the immunization schedule of the children, is mainly given to the mothers, or rather women between ideally the age of 9 to 26 is vaccination against cancer. Now this cervical cancer vaccination is the only vaccine against cancer, and as we are talking about the prophylaxis and for better life in India, the incidence is now slowly going down, but it is still definitely a #1 cause of death by cancer in women, especially in the rural region. So cervical cancer vaccine, the first shot can be given after the patient delivers, and because now she is very much motivated and counseled well, she will definitely come for her next 2 shots. So we need to use this opportunity for prevention of cervical cancer. So this cervical cancer vaccine, and second is about the contraception. These are the two important points which we all should discuss with our patients who have just delivered, because they're so motivated now. They will listen to whatever you say. Right.
Thank you so much. So I think we are nearing towards the end of the session. So the wrapping up pointers. So Dr. Garima, would you like to sum up the session in the best possible way?
Immunization gets us closer, no doubt with that. The compulsory vaccines of pregnancy, the 2 tetanus shots should be taken. Those who can afford it and can take it, please do not hesitate in taking your optional vaccines during the pregnancy, post the pregnancy, and pre the pregnancy. And as far as the COVID vaccine is concerned, debatable whether in the pregnancy or not. We would love to give it, but still, because the safety factor in debate. But at least what we know is safe. Let's go ahead and take those vaccines to protect ourselves.
That's wonderful. And Dr. Shubda, would you like to give us some information that we've missed out or we need to be aware of?
And you have already covered everything. What I can say is prevention is the best cure. That's the only thing. So see that how you can prevent illnesses, whether it is infectious illness, whether it is lifestyle changes. See that how you can improve your life. So be aware. So you should get the knowledge, discuss it with your doctor, and follow whatever suits you and what is best for you. Yeah.
Wonderful. Thank you so much for your time and all the information. And now we've realized that as moms, we are so into probably once your children are born, we do not care. I mean, that becomes your priority. And today, in this World Immunization Week, on this occasion, we've gone and discussed not only how we care for ourselves before we deliver our babies and for our babies when they are delivered, but even later on in life when we need to be as fit as them. So thank you so much to both of you for your valuable time. I know this time is a really busy time for all of us who are in the medical and health profession industry. And the fact that you've come and shared your experience is really wonderful and really generous on your part. And thank you so much for your time.
Yeah, we are also thankful to GSK and you, Dr.
BabyChakra.
Yeah,
for
BabyChakra. Yeah, because that is how, as a society, we are going to do better.
Right.
So
Thank
it is
you.
our social responsibility, and I mean, there's no need to thank us. It is our duty. I feel.
I know it is. It is
Yeah,
our privilege to be able to
yes,
imbibe
and
this
our
information
privilege.
among so many people.
Yes.
So thank you
Thank you
so
so
much.
much.
This public awareness initiative was brought to us by GSK and BabyChakra in collaboration. And two lovely doctors were with us today, Dr. Shubda and Dr. Garima, who gave us their valuable time. And to all you lovely moms and ladies out there who gave us 1 hour of your valuable time and could be a part of this session. It was lovely having you all. Thank you so much.